Hi, I'm Dr. Barry Gillespie. I practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, the United States of America. And today I'm going to discuss adults and craniosacral fascial therapy. My journey began when I graduated from periodontal school in 1975. And I'd been to dental school for 4 years, and I'd been to periodontal and TMJ school for 2 years. And basically I thought I knew everything about TMJ, about clenching the teeth and headaches and neck aches. And what happened was, about a year later, 1976, I started developing headaches and very bad sinus problems. And I went to my medical friends, and nobody really knew could help me. And somebody told me about a chiropractor who was in the area. And I went for a visit, and I walked in, and he said, he looked at me and he said, "You have a cranial problem." And after 10 years of medical education, I had no idea what he was talking about. But it was true. I did have craniosacral issues, I had myofascial issues, I had TMJ issues. And it was interesting because in 1975, I thought I knew everything. About 5 years later, I felt I knew nothing. So it's been a journey for me, and what I found in my therapy, in my correction, that as I went to my practice in the 70s, many adults had headaches and jaw problems and neck aches and back aches, and they had craniosacral fascial strain also, so I incorporated this work into my practice as part of being a periodontist. And that's how we got started in the 70s. I started with adults, and then we worked with children and with newborns, but it all started with the adults, and that's what I'm going to talk about today. I had many great mentors. My first mentor was Dr. George Goodhart, and he discovered applied kinesiology, and he was one of my teachers, and he came to Boston to teach. And he was a great guy, and he used me as a subject, and he worked on me, and I just loved this whole structure and function. One of my later mentors was Dr. Viola Fryman. And Dr. Fryman is an icon. She's still living today in 2016. She lives in California, and she taught me the cranial osteopathic approach. And I was her student for a number of seminars. And she basically gave me the feeling of brain motion and how the bones moved. And I followed it up with a number of people who studied directly with Dr. Sutherland, who discovered brain motion in 1899. And one was Dr. Ann Wales, and she lived in North Attleboro, Massachusetts, and I lived on Cape Cod at the time, and I remember spending the day with her. I'd go over and sit with her, and she used to bring out her writings and used to show me certain things, and we used to talk about Dr. Sutherland and talked about cranial. And I also studied with Dr. Brooks Walker, and when I used to fly to Nantucket and I worked there on Wednesdays, I used to discuss the cranial work with him. He studied with Dr. Sutherland. So it was a connection where I was working with the old-timers, people in their 80s who had studied with the person who discovered it, and I just wanted to glean as much information as possible from them. And when I moved to Philadelphia in 1983, I was looking around to see who did cranial work then, and there's really no one except this physical therapist named John Barnes, who happened to be in Paoli. And John and I became fast friends, and I worked in his office for 10 years. And all that fascial work that I didn't even know what I was doing. I knew I was doing something in Massachusetts. Oh, that was all myofascial work, which John was teaching at the time. So I learned quite a bit from him. He is the master in fascial work, myofascial work. So I've been very, very fortunate in my career to have mentors who were probably some of the best people in the world in their fields. The craniosacral fascial system is a system that I discovered about 20 years ago. And it consists of two aspects, the craniosacral and also the fascial aspect. And the craniosacral involves the brain, the cranium, slowly expanding and slowly contracting. And this expansion and contraction is called a brain cycle. And I have a little toy here. A lot of times the mothers will bring their children in And the child's brain is not breathing very well. It's very, very tight. There's a lot of pressure around the brain. There's no expansion and no contraction. And after the first few visits, the brain will slowly start to expand and slowly start to contract. And the brain will slowly start to contract more after later visits. And hopefully we like to get up to 100 seconds if possible. And the brain will contract around 100 seconds. And this total brain cycle will be about 200 seconds. At the same time, the sacrum, or the tailbone, right below the spine, the sacrum will be slowly flexing as the brain expands and slowly extending as the brain contracts. So it's this craniosacral action that allows the brain and spinal cord to move and to breathe. The second aspect of this system is the fascial aspect, the fascial web. The fascial web is this connective tissue from head to toe, finger to finger. It supports our organ system. It surrounds every muscle. It's within every muscle fiber. It goes into every organ. It surrounds every blood vessel and nerve. It goes into the eyes. It goes into the teeth. And if the system is loose, that should be okay, but a lot of times trauma will create restriction of the system, and the system will get tight. And it's this tightness of this craniosacral fascial system that's what we deal with. I'd like to talk about the adult onion. And when we talk about an onion, we talk about the layers of trauma that an adult may have in his or her life. It may have been that accident they had, the car accident they had a few years ago, that fall they had 5 years ago, that sports injuries they had in college. When they were in high school, they had a football injury, or they fell off their bike as a kid. It can go all the way back to childhood, where they were running and they fell and hit their forehead against the side of a piece of furniture. It can even go back into birth, where there was difficulty during the delivery, difficulty during the labor, difficulty during in utero. So we're looking at the adult onion, the lifetime of trauma that's sitting in your body. So when an adult comes to me and says, oh gee, I have a headache or I have a neck ache, I have no idea where that problem started. That problem may have started in grade school. That problem may have started with their whiplash accident from 2 weeks ago. That problem may have started all the way back into in utero. So you don't really know where you are in that onion. And if it did happen when you were very, very young, what we have to do is to go through a lot of therapy to peel the layers of that onion to get you back into that time where the trauma caused the issue that you're living with now that you're 47 or 52. So that's what therapy is. It's gradually peeling the layers of the onion, going back through all the traumas of your life. And sometimes emotions will come out with that. You may have feelings of anger, feelings of fear, different emotions will come out with it. You may have different feelings that you haven't experienced before. Give you an example. Sometimes an adult will come in and they're 38 years old, and around the 5th or 6th visit they may say, gee, I feel like I have asthma again. And I said, well, what was the story? Well, I had asthma as a kid. I said, well, you're peeling the layers of your onion. You're back into the layer of that childhood situation where you're releasing the tightness around the respiratory system. So the asthma symptoms are usually transient, they're only temporary, and they'll pass. The ultimate goal for an adult is to peel the onion back all the way back into your birth trauma, to where you possibly had a problem then, where you had colic, or you had reflux, or you had nursing issues, where all that is relived, and you clear that so your body is free of all that craniosacral fascial strain. The favorite aspect of CFT is prevention at birth. And we see so many adults and so many children, and I look at their situation and we start peeling their onion. And I say, this problem probably started at birth, and it's too bad nobody was there, when you were 5 minutes old to check and to see if you had a problem, and if you did have a problem, to do therapy when you were 10 minutes old to release all the strain, so you wouldn't have to live your whole life with a headache or a neck ache or asthma or a cognitive issue where you had difficulty reading, or difficulty doing math, or difficulty focusing or concentrating, if you've had a lifetime of these issues, we should be able to mitigate them right at the birth. And if you had your first therapy when you were 10 minutes old, you could have more therapy later that day and the next day. And the ultimate goal is in the first few days of life where you're strain-free, where all that trauma that you may have had in utero during that labor, that long, hard labor, and during the delivery where there were maybe forceps or vacuum suction or the cord is wrapped around your body, where there was trauma in there. And all of that has been mitigated, and you'll be free of all that, where you don't have to suffer your whole life with these problems. So I'm very, very excited with the work at birth. And I know for everyone here listening to this, we missed the boat, but we'd like to have our children, our grandchildren, our great-grandchildren to have it done so they don't have to go through a lot of the issues that we went through. When I was a kid, I was a sickly kid. When I was little, I had allergies, I had sinus problems, I always had sore throats, I missed school, I had reading difficulty, I had cognitive issues. I had to go to summer school one year because I had they called remedial reading when I was 12. I could read well, but I couldn't process what I was reading. And when I look back on it, I said, you know, all these situations, I said, gee, I wish somebody were there in 1947 to look at me when I was born and to have this work done. It would be a beautiful thing. So I think it's such a great gift, and our goal is to have every newborn on the planet have this work done at birth so they don't have to suffer their whole lives because of they had a difficult birth. Thank you.